So will South Africa meet its vaccine target for the end of the year? It's looking less and less likely. To date, over 17 million vaccine doses have been administered and over 8.6 million people are fully vaccinated. That's only around 1/5 of the country's adult population. Let's get more on this story now. We can speak to Aims Dhai, of course, from the Ministerial Advisory Committee on COVID-19 vaccines. Thanks for your time. We appreciate it. The concern, it seems, for the Gauteng Premier is that over 1 million people have not come back to get their second jabs. Let's talk about that and focus on that first, because if you get your first jab, you're not really that well protected against this virus, isn't it?
Good evening, Shahan, and good evening to your listeners. Yes, you are correct. You're required to have both jabs to have the optimum protection against the virus. So it is critical that vaccinees come back for their second jab. It's really important because it would be necessary for that protection in that being totally vaccinated will protect or decrease against onward transmission of the virus, and in that way help to protect the people that you are in contact with.
Yeah. So, some people might have just missed the appointments because they were working, etc. How much time do you have? What period of time do you have to actually get the second jab in order for it to be as effective?
It's after 42 days, and you can extend it for a few more weeks. But, we need to go to look at it in terms of scientific evidence. And with regard to the durability of the first jab, I don't think that you can stretch it beyond 12 weeks. The protective effect is going to definitely start waning off.
Yeah. And let's just try and educate South Africans about why it's not a good move, because maybe some people got skeptical, right, along the way after their first jab, given the misinformation that's been peddled out in social media. Why is it so important to get that second dose of the Pfizer vaccine in order to protect yourself?
I think one needs to look at it as not only protecting yourself, but also protecting people around you as well. No man is an island. And even in our South African, when we look at our South African indigenous values and our Ubuntu principles, we need to look beyond individual selves and communities at large as well. So it is so important in terms of, it is really important to take that complete vaccination, because we're looking at protecting the health of the nation. And what do I mean by protecting the health of the nation? It's not just the medical health, but we're looking at the economic health and the social health. The economic health would be, we'd be able to open our economy, we would be able to start getting back to work without restrictions, we'd be able to get rid of the lockdowns. And in terms of social health, I think all of us are socially and mentally fatigued by this COVID. And, we're fatigued in terms of working in cocoons, and we're social beings. We need to get out. And we need to socialize with our fellow human beings as well. But most important as well is when you look at protecting, this people by decreasing onward transmission, you are actually looking at it from a harms perspective. So, you take the vaccine not only to protect yourself, but to prevent others from getting harmed as well. And I think we need to start moving away from the I, me perspective and consider ourselves as we one South African community.
Yeah. Are we at risk of wasting the current doses or some of the doses we have if people don't go for their second jabs, especially since we're seeing a pretty low turnout in terms of generally South Africans going to get vaccinated?
We may be at risk, and I think if people don't turn up and our vaccines actually expire, I think we would have ourselves as irresponsible South African citizens or people living in this country to blame. It would be unconscionable to actually put vaccines down the drain when so many in the world need the vaccines. So, if we resist in taking the vaccines, we need to look at the impact it will have on others and on ourselves as well. Now, just look at hospitalization. When you look at who's in the ICUs and who are dying with COVID-19, it's usually those that are not vaccinated. We need to, we're at a lull at the moment, taking a bit of, there's a bit of relief in terms of the pressures on the healthcare workers. But, there's real concerns about the fourth wave if it does come and people are not vaccinated. Our healthcare workers have been working 18 months non-stop. The pressures are going to go back onto them. What about others who need other types of non-COVID healthcare? That's been put on the back burner as well. And by you not taking the vaccine, you're actually denying people their right to healthcare, to access healthcare, as per Section 27 of the Constitution. So, I think it's important that we start thinking along these lines as well.
All right. Thank you so much for your time and your insight. Really do appreciate it.